Hi, I'm Kim Higdon. I'm doing my health assessment video. This is Sally Cockrell. She's my patient. First of all, I'm going to have her walk so I can just check her gait to make sure she doesn't have anything uneven, that she walks normally. So if you'll just stand up and kind of walk to the door and back. Okay. Any dizziness, anything like that. And then we'll just kind of do, first of all, I'm just going to do kind of a palpation. I'm going to do a quick little head to toe assessment. And I'm going to have her lay back because I'll assess like her heart and her lungs and different stuff like that. So first of all, we'll just kind of feel around her head just to make sure we don't feel any lymph nodes, any abnormalities. We'll check for trigeminals by doing this. We'll check tracheal line deviation. I'll have her open her mouth and I'll look down to make sure there's nothing to open your mouth. She looks good. You can tell she has some caps. Go off. Lift your tongue up. You know, no odor. Her mouth is clean. Then we'll just kind of do a little assessment, just kind of go down, check the sternum and stuff. I'll go down her arms real quick. I'll kind of feel for pulses, just to make sure I feel equal pulses on each side. I'll have her squeeze my hands, squeeze, squeeze. Raise your arms above. Any problems with doing that? We'll kind of check her hips, make sure there are no problems there. We'll go down just to make sure like her kneecaps and everything are in place. Just to assess, make sure there's nothing. We would take her shoes off and check for pedal pulses too, just to make sure she could wiggle all of her toes. Can you wiggle your toes? You feel me touching you? We'll check deep tendon reflexes by having her push up against and back. You feel any pain in your calf muscles? No. Can you raise your leg up? Yep. Put it down, raise your other leg. Okay. Then I'll have her set up so I can listen to heart and lung sounds. And I'll check her reflexes on her knees and stuff. So if you'll scoot to the end of the bed. So we just kind of go like this. If we don't have like the little hammer looking thing, we just you can use your hand to check that. We'll listen to lung sounds by, you start on one side. Have her take a deep breath. In, out. Just breathe natural. Then you go straight across to the other side. In, out, breathe natural. You go down to the bottom. Out, natural. In, out, and natural. You listen to her apical heart rate for at least a minute. Make sure she has a love dub. She does have all that. I go ahead and assess breath sounds on the front as well. Just breathe natural. Then we'll just have her lay back again and I'll listen for bowel sounds. I'll palpate her abdomen. And you just start up there and you use your base of your fingers. And you move, you palpate to see if you can feel the liver and how much it is. You have to kind of do deep in and out and see if she has any problems with when you do that. When you go in, any rebound tenderness, any of that. You listen for bowel sounds. To hear accurate bowel sounds, you have to listen. At least a good 5 minutes is what they say. And you listen in each quadrant, so you start on one side. And you move to the other. She has bowel sounds that you can hear. You don't hear any broods. I don't hear any of that. You can check her vital signs. For blood pressure, here's your cuff. And she's 98/60. Also, to make sure like you're hearing your heart sounds and she's perfusing, you listen to her apical heart rate while you check her pulse. Just make sure she's perfusing and it's beating at the same time. And you want to do this to count it for a minute. We'll do an eye exam and look at her ears. Use this and take this and you look in the ears just to see, you want to look and see, look in the ear canal, make sure like the eardrum, nothing looks busted. It appears, you know, there's pink, you can see the hair follicles. No wax. Have her turn, and of course you tell them what you're going to be doing. You look inside there. And it's the, you know, the color, it's kind of white, pink, and there is some wax buildup in this one. You can see the pearl, the white pearl color of the eardrum. It's pretty neat looking. Sorry. Actually, this one right here. For her eyes, and I did forget you would put gloves on with all of this, but look at her eyes. You just we turn this on and you'll take your glasses off. Let me get the light on. Just make sure her pupils are reactive, and you just look to see. I'm going to take the glasses off so you can get through there. Just look to see, make sure the sclera and everything, it's white. I don't see any redness. I don't see any foreign bodies or anything like that. Look at the other one, make sure, I mean, everything looks normal, the eye looks normal. Had the smelling chart, so you would have her stand and see what she can read. Go ahead and stand, at least, we want to do at least 10 feet, and with both eyes, what's the lowest you can read?
PEZOLCFTD.
So she can read the 20 at 10 at the very bottom. Cover up one eye, your left eye. What's the lowest you can read?
FDPLTCEO.
So she's 2013 with the left eye covered. Now cover the right eye.
PEZOLCFTD.
And she's 2010, and that's with her glasses on. You'd have her glasses off if, like, you were normal, if you were checking something with her eyes, like if she got something in it. Her gait's normal, she walks normal, she doesn't have any complaints, her lung sounds are clear, her vision is good, her reflexes are good, her speech is normal, and you assess that by she's talking to you, she's answering questions appropriately. She denies any complaints. Her vowel sounds are normal. Heart rate's normal. I think that's it.